Okay, welcome back everyone. We are now on to the second presentation, which is Interprofessional Fall Risk Prevention Protocol, Part 2. So this is really going to focus on the nursing and physical therapy aspects of assessment and training and intervention. However, it's important for all of us to know, in case nursing doesn't happen to be involved with a client, it's just PT and OT. We need to be aware of the medication side of things, and for nursing, it's really good to have a well-rounded understanding of all the other disciplines, especially because when you guys are doing the start of care, fall risk assessment, all these different things that go into the start of care OASIS now, it's just very holistic and well-rounded. So it's important to know all the aspects of all the different disciplines, and this will give you that idea. My goal also is in learning roles the roles of each discipline, we're going to have a better understanding when working together as a team of how to collaborate and have a good interdisciplinary approach to fall risk prevention for our clients. So I just think overall this is really important for us to use this type of a model in home care. Okay, so for the nursing side of things, I'm going to go into a screening assessment of fall risk factors. Just in general, as nurses typically do the start of care to kind of discuss some of those things. I'm going to talk about medical conditions and how those affect fall risk, and then a great deal in depth about some of the different medications and why they cause you to be at a higher fall risk. I do not discuss vitamin D in this case. I know we had brought it up in the previous presentation, and the issue for this is really that's something that can only be addressed by the doctor. So it's something that's important for you in nursing and all the disciplines to keep in mind that vitamin D can play a role. But again, it's something you're automatically going to have to refer to the doctor to know what their levels are and if it's something that needs to be addressed there. This first slide is going to really be a repeat from the first presentation where we talked about how to screen and assess, determine if someone's had recent falls, what their fall risk factors are, and then what interventions need to be done to help with these fall risk factors. So for nursing, this can be a little bit tricky because you might already know you're opening and getting PT involved. But if you're doing this fall risk assessment, environment seems to be a factor for them, then it may be important to get occupational therapy involved as well. Or, what are the different factors here? Is physical therapy doing the open, and then they're doing this assessment and they find out there's a medication issue or they're concerned and there's something they don't understand that could be related to falls, then they're potentially going to need to get nursing in to address it. So this is really a slide for nurses as they typically do the start of care, but it really pertains to any of the disciplines involved. So the next slide that's important to fall risk prevention is considering some of the medical conditions that a client could be experiencing that will put them at a higher fall risk. So the first one would be cardiovascular problems. And one of the biggest things in line with cardiovascular problems would be blood pressure issues. Next, cognitive impairment is a medical condition that can be significantly linked to fall risk. For instance, if someone has a cognitive impairment and their balance is poor and they're forgetting to use their walker, it's making them at a really high risk for falls. Sometimes it's just not having that insight into their deficits can definitely make someone a higher fall risk. The next medical condition is incontinence. So in a lot of cases, this is just rushing to get to the bathroom. Are they moving too quickly and their balance is not able to manage that? Are they moving so quickly they're forgetting to take their walker? Is there environmental hazards when they're getting to the bathroom and moving quickly? That sort of thing. Next, we have depression, and the main symptoms associated with that are some cognition and gait and balance problems that can make you a higher fall risk when you have depression. And lastly, foot problems. And we talked a little bit about that in the first presentation as well, that foot problems can really be linked to how someone's walking and able to balance. Okay, so next we're going to take a bit to talk about the different medications and how they affect fall risk. So first we're going to talk about some different psychoactive medications. Okay, so the first psychoactive medication that we're going to discuss is the family of opioids. So these are typically used for pain relief. Um, this involves medications like fentanyl, hydrocodone, morphine, oxycodone, and they can have a lot of side effects. So the biggest ones I've listed here are drowsiness, some cognitive effects, dizziness, and it specifically even states that a side effect of opioid use is an increased fall risk. Okay, so next we're going to talk about benzodiazepines, and these are typically used to treat anxiety, panic attacks, seizures, insomnia, and some that you may have heard of are Valium, Ativan, and Xanax. And so the side effects of these that really cause a fall risk for people are sedation, dizziness, weakness, and unsteadiness. And actually, you'll see this category of benzodiazepines kind of come up in, they fall within other categories as we go along here. Okay, so the next category is anticonvulsants. And so these have a few different purposes. They can be used to treat a variety of disorders. So everything from epileptic seizures to neuropathic pain to mood disorders. And some common ones you may have heard of are lorazepam, clonazepam, gabapentin, and carbamazepine. So side effects of these are dizziness, drowsiness, and fatigue. So those are all things that can affect your fall risk. Okay, so the next group is sedatives, and these are typically used to treat sleep or sleep disorders and anxiety. And a few of the medications you may have heard about in terms of sedatives are Ambien, Lunesta, and then also the whole category of the benzodiazepines can fall into the sedatives as well. So side effects of these are drowsiness, dizziness, and confusion, all of which can play a role on fall risk. Next, we'll look at antidepressants, and these are typically used to treat depression, anxiety, seasonal affective disorder, and sometimes post-traumatic stress disorder. So some of the antidepressants you have probably heard of are Cymbalta, Trazodone, Zoloft, Zyprexa, and Seroquel. And the side effects of these can be dizziness, drowsiness, and fatigue, all of which play a role in fall risk as well. Okay, this next category is antipsychotic medications. These are typically used for bipolar disorder, PTSD, which also fell into the antidepressant category, mood disorders, and schizophrenia. Some medications you may have heard of that are antipsychotics are Haldol, Thorazine, Abilify, Risperdal, and then also Zyprexa and Seroquel, and those two also fell under that antidepressant category as well. So some of the fall risk side effects included in the antipsychotic medication category are orthostatic hypotension, dizziness, and drowsiness. Okay, so for this next set of medications, we're getting away from the psychoactive medications and getting into just some other families of medicine that have some side effects that can exacerbate fall risk. So some of the side effects include dizziness, sedation, confusion, blurred vision, and orthostatic hypotension. So first I'll talk a little about the anticholinergics. And these are designed to block the neurotransmitter acetylcholine. So it's actually used for a variety of different disorders. So one is urinary incontinence, also overactive bladder. They can help with involuntary muscle movements, like within Parkinson's, and also help with COPD. So it kind of is a wide variety of diagnoses, but some of these side effects can impact fall risk. The next little family here are antihistamines, and typically these are known more in terms of allergy treatment, and one that you can think of that kind of embodies some of those side effects is Benadryl. That's really going to cause the sedation, sometimes, you know, lethargy, that type of thing. The next family would be cardiovascular medications. So this makes a lot of sense when you're thinking about blood pressure medications and how that can affect fall risk depending on what your blood pressure is doing. And then the last one is muscle relaxants, and that's pretty self-explanatory for a medication that can exacerbate fall risk. So next we're going to move on to some of the factors that fall in line more with physical therapy interventions. Again, this is important for nursing and occupational therapy to know as well, because we all work together, and it's important to note what PT is working on and what some of those fall risk factors might be in terms of strength and balance and mobility devices, etc. So this will be a little bit of review probably for physical therapists, which is the key points of some new information, but it'll be good information for all the rest of us to know as well. Okay, so I'm going to talk a little bit about PT assessment, exercise, instruction, that sort of thing. So one of the first key things to look at for fall risk prevention for physical therapy is mobility. So how are these people getting around their homes? Are they using a walker? Are they using a cane? Are they using that device correctly? And then are they carrying over what you're teaching them as well? So if while you're working with them, you're teaching them to correctly use the walker, but then when you leave, they aren't using a walker, what kind of a fall risk that creates in the home. This is especially important for all other disciplines to know as well. Even from a nursing standpoint, if they're in the kitchen when you come and you need them to go to the bedroom to do wound care, you want to make sure, okay, are you supposed to be walking on the furniture like you're doing, or walking with the furniture as your guide, or should you be using a device? Should you be using that walker? So that's a really important thing for physical therapy to be addressing, and then it's important for the whole team to know what they should be using for a mobility device. Next, physical therapy is really going to address balance. So this is always interesting. I'm always looking at the Tonetti score from physical therapists. I want an idea of if I'm going to take them into the kitchen for an occupational therapy task and I want them to stand and reach in cupboards or stand and do the dishes, can they physically do that? Is their balance okay, or are they going to be a high fall risk for that? So there's a lot of different factors, but balance can be a huge key to understanding what their fall risk might be. Next in that is looking at lower extremity strength and core strength. So, like we had talked about in one of the screens, can they stand up without using their hands, or do they need their hands? Because if they need their hands and their lower extremity strength is weak, then they're a pretty high fall risk, because that ability to use your legs to walk, you really need that strength and safety to be able to do that without being a fall risk. And here's another slide of some things for PT to assess, work on exercises, and instruct clients with. So the next thing to really assess for PT is lower extremity neuropathy. Especially people with diabetes who have neuropathy in their feet are going to have a lot more difficulty with being able to navigate at home. That sensation and feeling can play a large role in how safe they are moving around, and can tell us a lot about what their fall risk would be as well. Another key thing that we can look at from a variety of angles, nursing can address this as well as occupational therapy, but it's something that affects a lot more of our clients than we realize, is postural hypotension. So I have heard from a lot of clients in the past that I just fell. I don't know what happened. I was standing there. I didn't trip, I don't know what happened, and I just fell over. Or, I stood up from the bed and then I just fell over. I couldn't do it. And so this is a big thing that a lot of our clients don't realize, and they may not know what's going on. Um, and that's for us to assess that postural hypotension piece. It's very important for all the disciplines to be aware when this is going on, because we can tell a client when they're standing up to make sure they stand, get their bearings, get that blood pressure back in check before they're moving. Because at least if they're standing up at the bedside, at the chair side, if this postural hypotension kicks in and they have a lot of trouble, they will not fall. They'll sit back onto the chair or bed they're on. So this is something we really need to make sure we're aware of. And then also we're addressing what the root cause of this postural hypotension is. Is it a medication? Is something else going on? So this is something we need to know in terms of each other and all of our disciplines and what we're doing to address it, as well as making sure we're in contact with the doctor to discuss this as well. The last key part here in the PT assessment is a feet footwear check. This is really important. Everything from orthotics, if they're having foot or ankle issues, to making sure they're not trying to walk around in their slippers that are open in the back and not understanding what the problem is. I mean, if they've already had a fall this year, they're using a walker, their balance is poor, and then they're wearing this terrible footwear that could potentially just slip off their feet. Obviously, that's going to make them an even higher fall risk. So again, this is something that PT should check for, but something we should all be aware of when we're working with clients and making sure that they've been checking their feet, making sure there's no sores, and making sure their footwear is correct as well. Okay, so thanks so much for watching the second presentation. So far in the first presentation, we went over fall risk prevention, fall statistics, the approach of screening, assessing, and intervening, as well as an interdisciplinary approach. And then in this presentation, we went over the roles for nursing and physical therapy, as well as how their roles and what they learn is important to the team. This final presentation will be about occupational therapy's role. It will also focus on client training, and that'll look at some of the stages of change model, helping people get from the pre-contemplation, contemplation, preparation, action, maintenance stages to get through the process to actually make a change to help prevent falls in their life. And we'll also discuss a little bit about the interdisciplinary aspect and what we're going to be looking at doing with that for the implementation of this protocol in March. So thanks for sitting in with me.